Okay, Reg, thanks for joining us.
Absolutely.
And, well, I'm sorry. Sorry you have to. Oh my goodness, so that's it. How did you do it?
Well, this is a steam burn. I lost a battle with a steam kettle. Inadvertently got in the way, and this is the result. So I guess this is a little more severe than first degree, so
yeah, it is.
I thought I'd come in and get it checked out so I don't develop any infection. I've kept it sterile and covered.
When did it happen?
Yesterday morning.
Is it hurting pretty bad?
No, it hurt maybe for the first hour.
Okay.
It's been, not even really irritated. I've had a little itching around the periphery, but
okay.
Other than that, no, it hasn't hurt. Of course, I haven't poked at it, but...
That's right. So you can see that there is a blister that's formed, or a bulla, and that's traditionally what would separate a first degree from a second degree burn. We like to keep them intact. There's conflicting data about what to do. Some people say that it's better to open it up and then put a dressing on and let it heal. Other people say it's better to leave it intact, that actually what's in there promotes healing. When they analyze what's inside of that fluid that's in that blister, there's actually some things that are good and some things that are bad. And all of the data for cutting it open and then putting a dressing on it are on very clean conditions in burn units where they take very special care to do it. So it's conflicting. My preference is to leave them intact and then to go ahead and use an antibiotic ointment. Now, if we're in a burn unit, or if we had a lot of burns, we'd have something called silvadine or silver sulfadiazine. That can actually cause discoloration of skin, but it works great for protecting burns. But so does any antibiotic ointment. Make sure it's not getting red. This little pink rim around it, we don't want that turning beefy red. Okay. We don't want redness spreading around it. We don't want to get it swollen. We don't want it getting more painful. We don't want you getting red streaks up the arm or getting a fever with it. When the burn is more fresh, we'll actually encourage you just to run tap water over it for both irrigating off anything that's on it that shouldn't be there and for pain relief. Okay. Does it hurt now?
No.
Okay.
I did that a couple of minutes after I burned it. I did run tap water.
You did the tap water.
A couple of minutes, and then put an antibiotic spray on it.
So let's get some.
What about an oral antibiotic, just in case?
They used to do that, and now the jury is in. We know that it's completely useless.
Okay.
Oral antibiotics in the setting of intact, what we call partial thickness burns. We called this second degree using the old language when there was first, second, and third degree burns, and there's actually even a fourth degree. Now we just call them full thickness or partial thickness, so we call this a partial thickness burn. And we're going to get some kind of a sterile spatula here to help distribute that. Put a nice barrier over that. Irrigation, surgical wash, antibiotic covering, and then this Mepilex, which actually I think this might even be available on Amazon, I'm not sure. So this has the adhesive that kind of holds it down. So actually I don't want you lifting this up. I want you just simply looking at the outside of it. If it feels different, then let's look underneath. But if this is staying on with the help of something like this, then we'll just go with that. Okay. And leave that on until after the weekend. After the weekend, you can take a look at it and see how it's coming along. The blister should be healed up at that point. We also want to make sure you're up to date on your tetanus shot. Do you know the last time you had a tetanus shot?
Don't. Alright, so just relax this arm. Total dead arm. Alright. Small poke. Oh, I never even felt it. Didn't even feel it? Excellent. Okay.
Reg, thanks for coming in and showing us your burn. I'm sorry it happened. I guess you'd be more careful with the steam.
Exactly.
This we would estimate that it's about a 1% body surface area, 1% being about the size of a person's palm of their hand. a little bit less. Doesn't require any special treatment at a burn center beyond what we've done here. It's just partial thickness. It's going to heal up just fine.
Okay, very good.
All right, thanks for
Doctor.
joining us.
All right.
And if you enjoy watching our videos, please do subscribe. And if you want to watch some funny comments and responses to comments on our channel, check out Dr. Terry Bull's channel also. We'll have a link to that. Until next time, this is Dr. Mark Vaughn and Reg telling you to stay in good health. Thanks, Reg.